Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Kim Klimek, who is a licensed pharmacist, certified hormone replacement therapy specialist, and certified functional and lifestyle clinician coach. Kim's personal journey of struggling with endometriosis, hormone and gut-related issues, stress, and multiple surgeries is what led her to seek information about root cause medicine strategies. Specifically, after her second laparoscopic surgery for endometriosis removal, she was given a book by a coworker that focused on a more natural approach to healing that truly changed her life and led her to questioning a lot more of what she was educated on in grad school regarding medicine and health. She instantly knew that she couldn't turn her back on the power of supporting the body through a more holistic approach, and now she does that for others as well. Through her business, Innate Healing and Performance, Kim specializes in helping others with hormone-related issues, gut and digestive imbalances, autoimmune and chronic health conditions, and for those looking to optimize their wellness so they can live vibrant, healthy, energized lives. Outside of her professional life, Kim loves reading, cooking, researching, training for triathlons, which is swimming, biking, running races, and spending time with her family. This 4-part series with Kim is jam-packed with explanations, tips, and science behind many of the hot topics of functional medicine, as we cover Kim's health journey and an overview of functional medicine in Episode 1, Functional Medicine's Approach to Gut Health in Episode 2, Balancing Act, Women's Hormones Explained in Episode 3, and environmental toxins and their link to autoimmune or chronic illnesses in Episode 4. Kim is a super deep wealth of knowledge. She has a ton of certifications, and she is making a difference to so many people already in our area, and we can't wait for you to learn from her. So let's get started with today's episode. Welcome back, and we are back here with Kim, and today we are talking about hormone balance. This is a hot topic that I think a lot of people are really interested in. Welcome back, Kim.
Thanks.
So to start out with, let's just define, what is a hormone?
Yeah. So a hormone it's this little chemical messenger and structure. So the actual hormone, it's coming from the backbone of the similar structure that is the cholesterol molecule. But it is a little chemical messenger that sends all these signals to your body and your body cells to basically carry out their functions. And as we know, the body has many, many functions. And those hormones are probably one of the most important things that your body needs to have balanced and regulated for you to be able to function. So it's metabolic function. It's like thermal energy in the body. It's the thyroid regulation. So all of those important functions that your body needs to operate well.
So how does hormones influence like the metabolism, the mood, sleep, your overall vitality? How do these little messengers change those things?
Yeah. So I wish I could draw a picture for people, and I often do, but we have these so we have a cell. So think of a cell as like this circle. And then if you think of all of your cells have these they're called receptor sites. So it's just like a little binding site on the cell. And what happens is the hormone comes in there and it's able to bind, and just like a little lock and key, it fits in there perfectly. When you have the right hormones and you have them in the right abundance and the right structure. So that'll be important as we talk through that. But it turns it like a lock and key and opens it, and then your cell's able to carry out all those functions that you just mentioned. So that's kind of the general.
Just how it works.
Yeah.
So what are some common symptoms of hormone imbalance, especially in women? Like what do people see and then how does that correlate to hormone imbalances?
Yeah, for sure. So for women, well, we can have hormonal imbalances pretty much
Yeah.
any stages throughout our life, and so that's why it's extremely important for especially the female population to understand just where your hormones need to be at different stages in your life. So it's different. There's different needs when you're in your like teens and early 20s to when you're in your 30s and when you're in your 40s and kind of menopause time, menopause and postmenopause time. So and that is seriously what the word hormone balance is all about, because people will need different the abundance or the presence of the hormones at different levels depending on where they're at in their life. But oftentimes, so like I would say in the younger population, like the 20s and 30s, a lot of women are dealing with sort of PMS type issues. So, and this usually comes in the second half of the cycle. So we all kind of had these first 14 days of the cycle. In a perfect ideal world, it's to a 28-day cycle. And in the second half, we usually have this, in the second half, so the second 2 weeks of the last 14 days of the cycle, we normally have this beautiful progesterone peak that's supposed to happen. And I think a lot of women right now are experiencing sort of progesterone deficiency. So they'll experience symptoms like bloating, fluid retention, depression, anxiety, PMS, irritability, feeling like they could just cry at the snap of a finger, or they want to like yell at their partner for no reason.
Yeah.
I've experienced all these symptoms, let me tell you.
I was just going to say, I'm feeling this right now. I feel it.
Yeah. And so that's a very common one. I definitely would say about, 80 to 90% of the clients that I'm seeing are dealing with that. And it does make me a little bit sad because we're starting to exhibit it younger and younger, because I do have clients that are like in their 18 and like, pretty much as soon as you start your cycle, any of this stuff can happen. And a large portion of the reason that that's occurring, and again, those symptoms can be very prevalent for perimenopause and premenopause women as well. Because if we look at it's kind of the hormone production cascade, if you will. I always tell people if everything is hunky-dory and everything's great, your body is going to there's kind of two routes. It's going to be on this little route and pathway of making your hormones and doing what it should do. It's going to make your progesterone. It's going to make your DHEA, which, can transform into testosterone. Then that can transform into estrogen. I show them these things through like a Dutch hormone test or a saliva test, or kind of break it down. And I show them the little pathways. But when we're stressed, when we have huge moments of imbalances in the life, and a lot of it is stress. I just don't think we can kind of get away from stress. But when someone's in a little bit more of a chronic, like fight or flight, or just chronic stress, and it's over time too, kind of just the body manifests stress in so many different ways. You can say you're not stressed, and sometimes I'll see differently on a cortisol panel. So someone can think that they're not stressed, but their body's manifesting it or holding it in other types of ways. And I mean, there's that we can get into the whole realm of holistic healing, and there are ways to help that. But when that's kind of going on, the body says, whoa, I don't need to be over here making your hormones. I'm going to shut that whole pathway off, and I'm going to come over here and I'm going to make cortisol. Because my primary job is of cortisol, it's actually anti-inflammatory in the body. So it sees this kind of like inflammatory state and it says, I need to shoot out cortisol to help control that. And then that's where we get in trouble, because the body says either it'll just start making like lots of cortisol and it'll be hanging around. So because then you can look at like how well someone's actually processing that cortisol. Are they eliminating it through the body? If it sticks around too long, that's bad. But the overall picture here is we tend to see this hormone deficiency or depletion, especially in progesterone, when the body has to prioritize making cortisol. And that's one of the primary symptoms right now. And then that can lead to what we call, so that's called like luteal phase deficiency in general. Another symptom that I'm often seeing right now is a huge, for especially younger clients, it's huge exposure to bad estrogen, if you will. And I need to clarify for sure on this podcast that there is definitely a time and place for good estrogen and bad estrogen. So, or you want to know the difference between both is what you will, because generally when you get to like menopause, there's a huge shift and people have no estrogen. So they're starting to exhibit things like hot flashes, night sweats, memory issues, like cognitive decline. Like I don't even remember I put my keys the other day, or they'll be talking to their partner and they say things like, I don't remember what we were talking about like 2 seconds ago. Like that's how bad they're starting to have memory issues. And then of course there's a large, even as many studies as there are out there that are telling you these woes and nays about like hormones. I don't think there was ever really a discrepancy that having good estrogen levels is important for bone health as you age. So it puts many women at risk for like risk fractures and falls and things like that when they don't have good estrogen to support their bone health. And that's definitely a huge symptom that people start to exhibit, or they'll get their DEXA scans with the doctor and they're starting to get like osteopenia or osteoporosis.
And what's the bad estrogen?
Yeah. And so the bad estrogen, this is where I'm really breaking it down for people. There's sort of three, and they're called E1, E2, and E3. Estrone. So it's all in the name. Estrone is E1, estradiol, di means 2, estriol, tri means 3. So E3. E3 is sort of, and this is all, my kind of education and training that I've done through PCCA and with Dr. Smith's personalized medicine certification course. But E3 is more of estriol is more of like a protective estrogen in the body. None of us really make any unless we're giving it to people supplemental through bioidentical hormone support, or the body generally makes a little bit during pregnancy. But the two bigger ones that we're often concerned about looking at is estradiol levels and estrone. So in the younger populations, what I'm seeing more and more is, so they could have luteal phase deficiency where they don't have enough progesterone, but they could also have what we call estrogen dominance. So which was my case of endometriosis. I kind of have both. I had such high levels of estrogen in the body, and estrogen equals growth. So that's why people kind of get scared when they hear about hormones. And again, it's just the context and knowing and being educated of what's good and what's bad and where your levels need to be at, because estrogen is good. It's actually important for like 400, 500 different functions in the body. I always give people, there's like a link on ZRT Laboratories who I use for saliva testing, and they have a 90-minute video on there. And so if you're ever afraid of estrogen, go listen to that, because it'll tell you all the wonderful and beautiful and most important things that it's responsible for. But when we get sort of an overabundance or overburden of it, and again, that's kind of coming from chemicals in our environment that mimic the same structure as estrogen. So when I just talked to you in the beginning about those little receptor sites, what happens is we get what they're called xenoestrogens, and they mimic the same structure as estrogen, and they'll come in there and they'll bind on that receptor site in the cell. So then when you think about all your cells and how all your organs are kind of made up of those, they can kind of get bogged down with too much what I call fake estrogen. So people start to exhibit painful periods because they're starting to get excessive fibroid growth, cysts, because again, estrogen equals growth. And that's generally what I'm seeing in the younger population. And then we get endometriosis, where we get all these growths outside of our reproductive organs that are not able to be shed with the lining and leave the body where they're supposed to be. So they can kind of back up in the lymph pathways. They can grow outside the reproductive organs. And, at that point, that's why, I do think there's that huge component of how conventional therapy can help with these things. But it's our job, and it's my job as the clinician and with my clients, is to help them have strategies so they can prevent that from happening again, even if they do choose to move forward with a surgery or something like that. Sometimes these issues can be extremely painful to the point where women are getting, or they're sort of being, I would say, offered the solution for a hysterectomy and being told that this is their only option. And there's consequences of that, because I've had clients say, well, and I never, with clients, I'll never say, that was bad, you shouldn't have done that kind of thing. You make the best decisions that you can with the information that you had at the time. And so we always move forward. Same with me. Do I wish I could go back in time and never have all these surgeries and have my colon removed and all that stuff. Absolutely. But I made the best decision I could at the time. And now I've been able to heal the body, and you really, really can. So many women who will get like a hysterectomy, they don't realize that there are progesterone receptor sites all along the uterus. So when they get it out, they really start to exhibit a lot of progesterone deficiency symptoms. And like sleep is another really big one linked to progesterone levels, especially in the second half. If you are exhibiting like a lot of insomnia issues, it can be related to progesterone deficiency for women. There's a natural process that happens with aging where we just slowly decline with these hormones. So again, it's not your fault type of thing. But some people, they may, I would say they're the lucky ones for sure. They may not like exhibit that loss. Like there's definitely a small percentage of women as they hit like the menopause time frame where they don't exhibit any like hot flashes, night sweats, these type of issues. Because we are taught that there's a small percentage of women that will still make their good estrogen as they need it. Otherwise, again, people are just told that they have to suffer through these things, and they weren't really offered any solutions. And that's sort of where bioidentical hormone support comes into play.
So I think that leads me into a really important question of in these different phases. So let's say you're in the childbearing years, and then you're in perimenopause, and then you're in menopause. So whether you're in any of those phases, if your hormones are imbalanced, what is your approach to balancing them? Does it come down to supplements again, nutrition? Like what is the general approach on how to help these balance back out?
All the above.
Yeah.
My strategy is, I would say it definitely differs a little bit from some, I would say even some functional medicine practices that I've had the privilege to kind of learn from a little bit in the community as a pharmacist working at the compounding pharmacy, is that my goal isn't to just, because we'll talk about bioidentical hormone support, but it isn't to just give them that and send them along their way. It's to have them understand how nutrition can really help like their body, especially for women who are exhibiting like menstrual and period pains. Like I'm giving them like ways that they can optimize their supplements and their nutrition and the lifestyle. I'm getting down to things like, oh my gosh, I tell people the first and foremost thing that I ever did for myself with hormone balance was bought myself a castor oil pack. It was like the single-handedly the best thing that I could do, because they have ones I use this one from like Queen of Thrones. It's called. The company is really great. I mean, they have so many resources on there, but it's literally like you don't even have to take a pill or a capsule or whatever it is. It's an external organic cotton cloth where you pour a little bit of organic castor oil on it. And you can put it onto really any organ area on the outside. Primarily, if you want to work on hormone balance, you really want to get a liver castor oil pack or like a pelvic one, because I started doing that for pelvic pains. And it can help like break up little cysts or adhesions or fibroids. What you do is you drive that castor oil into the organ by putting the pad on, and you use a heating pad, or you put the castor oil pack on, then use a heating pad to drive it into the site. And you will notice things. I've had clients say like, oh my gosh, Kim, I use that castor oil pack and I can like feel things coming out of my liver.
Wow.
So yeah, I don't need a scientific article to tell me that worked better. Like I don't need an article or a randomized control study to tell me that I slept better, that my acne was clearing up, that I started having better bowel movements in the morning, that my PMS was starting to get better. Like those are the types of things that, these functional and kind of integrative approaches can help with.
How often would you recommend a castor oil pack? Because I have one. I use it, but I maybe use it once a month.
Yeah.
So.
In the beginning, I feel like if people are really struggling with hormone stuff, like you're just like listening to this podcast right now, you're like, oh yeah, I have all those symptoms.
Yeah.
You can definitely get it going with starting to use it like 3 to 4 times a week in the first like month. And then after that, I'm at a stage in my life where I focus a lot on maintenance, because let me tell you that once you get to health, or what you feel is your kind of optimized health, it's still about maintenance after that point, because I talked about how much we're always going to have these insults coming in. And if I let my guard down for too long, things start to creep in a little bit. But I only tend to use them twice a week now after that. And I use them. The liver one is more for the first half of the cycle, they say. And then your energy, I learned a lot through like Chinese medicine, and I see an acupuncture lady, and she's phenomenal, but she said your energy shifts the second half of your cycle down to your pelvic area. So there's a pelvic one that you can use during that time. And again, that's when people start to exhibit a little bit more like the bloating and fluid retention and things like that. And to your point, you can use, what I've found is that you can use nutrition and you can use herbals. There's like chest tree berry and like shishandra root, which are really prominent in the functional medicine space to help make progesterone. I'll tell anybody who asks me all day. I do use progesterone and bioidentical hormone support. Learned all about it through my job at the pharmacy, and it was probably the biggest life-changing thing I ever did for myself.
So you're a big supporter of that.
Yeah, I'm a supporter of what my clients feel comfortable doing. I provide them as much education as I can. I will promote. I pretty much don't promote anything that I wouldn't be willing to do for my body, to be honest.
Yeah. So when you say bioidentical support, is that hormone replacement therapy? Is that the same thing? Is that just a different way of saying it?
Yeah, good question. So bioidentical is the key word. So I tell people it is different. The hormone is different than what you're getting from like a birth control or a oral contraceptive or even like IUDs. IUDs generally have like Mirena, Skyla, those ones. They generally have something we call progestin, which is not the same as progesterone. I educate people. I actually do a webinar usually once every couple months on it to help people understand and educate, because we could go really into depth there. But in science, it's really all about the molecule and the structure. So when you think about it, you come down to it, your body recognizes this beautiful structure and molecule of progesterone. If you take, because when I was younger, I was getting Depo-Provera shots, and they came with a lot of side effects, right? And I was like, why do we exhibit all these side effects if we're getting this hormone? That's supposed to like help our body or whatever. But it was because when I learned that it was all about the molecule. So the structure for Depo-Provera is they'll take kind of sort of somewhat of a similar background structure to the molecule for progesterone, but they add what we call, and again, try not to get too sciencey, but it's like a side chain on the molecule. And all that is then your body can't recognize that molecule. It says, oh, okay, this, coming back to the lock and the key terminology, it'll maybe fit. You can kind of maybe jiggle it into that lock and it's not going to quite fit, but you can jam it in there, right? With this molecule that's not quite the same. And you try to turn that lock to open up the lock and have the cell carry out its function. It's not going to open the lock because it's not that exact structure. That's what the difference is between bioidentical. We're replacing or supplementing, if you will, the body with exactly what it needs or what deficiency it has. I always tell people, we do at the pharmacy, everything we do, we basically just use that structure, the same structure, a progesterone structure, the estradiol that's needed, or estriol. We use safe estrogen. We actually never use estrone because I don't even think I got into that, but that's sort of the bad estrogen, if you will. You don't want to have too much of that because of the way it can metabolize in the body. It does create risk factors for DNA damage and cell mutation, which is kind of cancer at the end of the day. And this is why you're seeing this prevalence of like breast cancer and things in women, especially younger and younger. That's why it's important to get your levels measured, because when you have an overabundance of that, it's preventative right now. Like you could do a hormone test and see into your future a little bit. Like if you knew you had these high levels, because you could actually
usually from like environmental toxins and stuff like that.
A lot of it is.
Prevented.
Yeah. And again, so that's why it's like, if you think that just using this product or this candle or whatever it is fine, in the long term, it's the chronic long-term exposure. Microplastics and getting way into that.
Yeah, we'll get into that next episode.
So what I tell people is, bioidentical is hormone support. It's beautiful. The beauty of it is we really just keep that same structure and that molecule that the body is used to having. We use like hypoallergenic creams and a wetting base. That's it. That's the only stuff that's in it. We don't put fillers, dyes, chemicals, and everything is customized for people. And even if they're getting like a progesterone capsule or something, you can get a clear capsule, a veggie capsule, like, making sure. We get people calling all the time, like, we have XYZ allergies to gluten, this and that. And that's the beauty of the compounding pharmacy. And I will rave about compounding pharmacies all day.
Amazing.
They help people so much. And I just kind of equate it to like when we learned about like type 1 diabetics, when they needed insulin, that's what we gave them. We give them, replenish them with insulin. It's the same concept here. We replenish the body with the exact hormone. And that's why people start to feel the benefits of it. And, I can't even tell you a single like side effect I really had from, supporting that deficiency in my body, and everybody's unique and different. And again, either way is fine. I've had some clients come in and say, I've been to XYZ. We did a lot of these like supplements and herbal therapies, and I think I'm just ready for this next step. And that's fine. And the other people are ready to jump right in. And again, it's really just the trust and that you have with your provider, that they're leading you down the right path and making sure that things are safe for you. So, and telling you what to expect, and working with you through it, because not everybody responds to, hormone support. And the huge difference is really it's the verbiage. Bioidentical hormone support is what it has to be, because I think a lot of times, and I'll kind of I can go off on a little tangent, but I'll keep it at this. When we were giving women anything for support, it was sort of like Premarin for years, and they still do. And it's, definitely one of the worst medications for you. And that's why there's all these black box warnings on it and things like that, telling you they have a risk for cancer and use it the least amount. But if your symptoms come back and you're having vaginal atrophy and all these things,
oh my gosh,
just deal with it.
Oh gosh.
Wow. Well, you are a wealth of knowledge on this. So first of all, thank you for sharing your knowledge. I think I love how we got a little bit sciencey in this podcast.
Yeah, for sure.
I think that it's really helpful to understand the backside of like, why is this important? But then I think you've given a lot of women hope that they don't have to experience maybe what their moms have experienced or their friends have experienced or what they're experiencing right now. Like, this doesn't have to be how they live just because they're getting older or just because they're women. Like, the amount of hope that you've given through this podcast alone is incredible. So if people want to work with you, I know that on your Motherhood Alliance profile, you do have an initial consultation 10% discount, and that code is new client 10. So you do consultations with people. If someone listened to this and they want to have a chat with you about their hormones or get them tested, what's the best way for them to kickstart contact with you? And then how would they apply that discount code as well?
So any clients that are looking to work with me, they go to my website and there's a button that says book an appointment, and it'll bring you to, I have a kind of a EHR platform, if you will, called Practice Better. And so it'll bring you directly to there. I have a couple options listed on there. The most common options that are selected is there's an option called Get Started, and it's a 75-minute initial intake where I deep dive into their whole health history. We get started with things right after that visit. So despite me, I will help guide you into what I think is going to be the best kind of functional and precision testing for you. My goal is not to, sell something to somebody that they don't really need, right? We need information that's going to actually help us. So this is where, I've had clients come in, they're like, I had a client the other day, she was like, I bought this Everywell test and I thought I could just do this all on my own. And I bought it and I got it and I don't even know what any of this means. Would you be willing to actually help me interpret this? And I think I should have just came to you in the first place. So, there's just things like that where she's like, and then after the appointment, she was just like, this is great. I really needed this all along to begin with. And because what I'm finding is just that this is a difficult field to navigate. I mean, I have this tremendous educational background regarding physiology and the body and science and math and lab tests and everything, but marrying that with all the education that you have to have for functional medicine, it's all about what your body needs, not what anybody else's body needs. And it's customized. It's all to you, and it's based on the data helps drive things for sure, because not everybody. We didn't really talk too much about, but I have clients who are polycystic ovarian syndrome too. And so they actually make way overproduction of androgens. And there's a lot of we're working through insulin irregularities, insulin resistance, infertility issues, oftentimes coupled with progesterone deficiency. So everybody is very unique. And so they can book the consult through the Get Started usually. I do have a couple clients. I do offer an ultimate package on there, and that's really for the individual who's I got a lot of stuff going on. I got gut issues going on. I got hormone issues going on. I never even had blood work done in 3 years, 2 years, whatever it is. I'm ready to jump in. That's going to be a definitely a cost savings for you because there's like 4 visits included in that for consultation fees and everything. So I have clients book those as well. And so those are my three kind of offerings on there. But I want to meet people where they're at as well with their capacity to start. And so when they leave the first visit, we're already getting started on stuff despite not having any data, because I can do a lot of stuff too based on symptoms, symptom assessment, and the way you answer and respond to my questions, because that feeds into what I know could be going on in the body.
Awesome. Well, thank you so much for sharing all of your knowledge with us. We have one more episode, so stay tuned. We're going to be talking about household toxins and more in episode 4. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.